about 5% of monocytes are in circulation. We'll check that number quickly.
Monocytes says 3 to 8%.
Okay, so my brain's saying 5. I was roughly right. Okay, good. I was about to have a TIA. Okay, so about 5% of all white cells are monocytes. Monocytes, though, are not really long in circulation. They're released from the bone marrow, they go into the bloodstream, and they move out into tissues. Once in tissues, they are now macrophages, or macrophage, or another word, the tissue macrophage. Cooper cells are macrophages. Macrophages were once in their life monocytes. But macrophages also phagocytize. So here we have broken that line of defense. We have an invader of some type, a foreign invader, come in and is in tissue. The neutrophil diapedesis out of the bloodstream into the tissue where that invader is. At the same time, macrophages that live in tissues for months get activated. So the tissue macrophage also goes to that invader and begins to surround, engulf, and phagocytize. They help do what's called wall off a pocket of pus.
Oh, is that why you get like that pus?
Yes. So, think about that pimple again. It stayed, hopefully, right there in that one spot because it was all that purulence, that dead bacteria, was confined to that one little area of your pimple, your acne pimple. That's called walled off pocket of pus. Because literally the tissue macrophages surround and join forces and try to prevent that invading bacteria from going anywhere else. So we don't see many in bloodstream. 5% of all white cells, roughly, are monocytes. They actually move out of the bloodstream into tissues and live for many, many months in tissues. Then their primary role is phagocytosis. Lymphocytes then are our final category. Lymphocytes are our immune fighters. They're broken down primarily. We're going to look at the T lymphocyte and the B lymphocyte. T lymphocytes are to recognize abnormal and foreign cells. If one of our spotty cells, remember in chapter 1 where it talks about cells becoming abnormal, cells that have such abnormal size and shape they are actually become malignant. If the T lymphocytes are functioning, T lymphocytes should destroy abnormal cells. That is called cell-mediated immunity because T lymphocytes destroy abnormal cells. Why then is cancer considered an immunodeficient disease? T lymphocytes didn't do their job. If the T lymphocytes are doing their job, they should destroy those cells that are abnormal in size and shape. And that really is your pre-malignant or malignant cells. So failure of the T lymphocyte to do their job probably results in cancer. If we could stimulate the T lymphocytes to do their job, that's immunotherapy. And some of the ways we're treating cancer is just that, stimulate T lymphocytes to do what they're supposed to do. Why do patients who have before I say that. If you have a transplanted organ, you got all these people with kidney transplant, heart transplant, lung, liver transplant. What cell should destroy that transplanted organ? The T lymphocyte. So when we do a organ transplant, we have to suppress T lymphocytes. Otherwise, the T lymphocytes will seek out and go and destroy that transplanted organ.
Is that what the drugs are for?
Yes. Immunosuppression. We suppress the T lymphocyte. What disease do you think they develop? We're suppressing T lymphocytes because we don't want the healthy T lymphocytes to destroy the transplanted organ. So what do we see developing in these patients?
Everything else.
More specifically.
Nosocomial
Not HIV. T lymphocyte does what? Kills what? Abnormal cells. Therefore, if we suppress the immune system, we're going to see more cancer in those patients. Because we have just told the T lymphocyte, don't do your job. Don't do your job. Because the healthy T lymphocyte would have destroyed a transplanted organ. But healthy T lymphocytes are also to destroy abnormal cells. So it's kind of a rock and a hard place. So we're learning more about cancer the more we know about transplanting organs. And then AIDS. Yes?
Aren't those drugs only like in your body for a short amount of time though?
If you've had a kidney transplant, you have to take it for life. Heart transplant for life.
So
Lung transplant for life.
your T lymphocyte won't like ever go bad.
So we have to suppress that part of it. Now there's a lot of variety of T's, but yeah, we're suppressing the T lymphocyte. So some of the early links to cancer being a failure of the immune system was back even in the 50s when we started doing kidney transplants, and they knew we had to suppress the immune system and lo and behold, they started having cancers. We'll take a brief look at AIDS. AIDS, the virus, resides on the T lymphocyte. And as that T lymphocyte multiplies, it procreates itself, it actually procreates the virus. But the virus destroys the actual function of the T lymphocyte. So yes, one of the problems with patients then with AIDS is they develop malignancies. Particularly malignancies that those of us with healthy T lymphocytes don't get. So AIDS is a failure of the T, or suppression of the function of the T lymphocyte as well. So T lymphocytes do what kind of immunity? Very specific. Cell-mediated. Destroy abnormal cells. Some people would say we all have cancer cells. But if your T lymphocytes are healthy, you've destroyed them before they ever grow enough to make disease.
Wait, so is that true? We all have this?
That's what some scientists will say.
Technically, it's not cancer.
Well,
She's
but you
saying
haven't
it's right.
developed
Yeah.
disease because you've got healthy T
So
lymphocytes.
you would have, technically you would have abnormal, everybody has abnormal cells in their body.
Right. Where in our body are T lymphocytes maturing? Well, they grow up, they begin their life in the bone marrow, true.
Thymus?
Thymus, got it. Maybe others did too, but I heard it over here. The thymus gland. Where is your thymus? This is thyroid and parathyroid. So where's your thymus?
Right below it.
That's
It's
like
straight.
right around
It's,
here.
if you have it, because in adults it often shrinks and goes away, but if you have it, it's in your mediastinal cavity behind your sternum.
So if it goes away, how do you get strong and mature T cells?
Well, the nice thing is when they grow and divide and make new ones, mommy teaches babies what they're supposed to do. You know, you pass on that immunological information. When mommy divides and becomes two, he shared her knowledge with her baby T's. What happens if T cells get too happy? And they start destroying parts of the body. They don't recognize self. Autoimmune diseases. And that's kind of the buzzword these days. If you don't know what else it is, it's probably autoimmune. Autoimmune means the T cell, the body is destroying itself. Failure to recognize self. Lupus. We'll look at these disorders a little bit more in chapter 7 as we look at chapter 7. But lupus, rheumatoid arthritis, myasthenia gravis are some autoimmune disorders that are common. The normal body destroys healthy cells. It shouldn't be destroying those cells. So failure of the T cell to recognize self-antigens is an autoimmune disease. So failure of the T to do its job may result in cancer. The T cell doing its job too effectively will result in an autoimmune disease. T cells are also involved in allergy, along with what? Granulocytes, eosinophils. T's and Eos involved in allergy. The B lymphocyte produces antibodies. Antibodies latch on to specific antigens to destroy the antigen. An antigen is a protein on the surface of all cells. Again, mommy B lymphocytes teach their baby B lymphocytes. These are the specific antibodies that you will make once you have been trained. We will be looking in detail at training these B lymphocytes with our vaccinations, the immunities. What's the difference between innate immunity, acquired immunity, active and passive? Start with that next week. B lymphocytes make your immunoglobulins. So antibodies and immunoglobulins. B lymphocytes. They circulate in body fluids. So they're called humoral immunity. Humoral, like the body humors. They circulate in body fluids. And so in the category of immunity, they're called the humoral immunity, T lymphocytes, cell-mediated immunity. There are many other lymphocytes, like natural killers and helpers and suppressors and activators, and we don't really go into detail on those. So in preparation for next week, one thing that we're going to deal with a lot will be immunity. Chapter 7. And these immune disorders. Going back into chapter 5. We talked a little bit about the use of the drugs that suppress inflammation. You do not need to know the specific drug names, just as an inflammatory suppressor. And as we end, steroids, the glucocorticoid steroids. They are made by the adrenal gland. They get activated in inflammation. We also give them in inflammation. Their primary role is to diminish capillary permeability. Make capillaries less permeable. If capillaries are less permeable, what happens to protein? Will it leak out if capillaries are not permeable? In other words, glucocorticoids help prevent capillary permeability. Try to keep capillaries normal. Remember, when capillaries become permeable, protein moves into the interstitial space.
So it's kind of like if you have eczema, you can apply an application of a glucocorticosteroid to prevent inflammation and irritation.
It suppresses the inflammatory response by trying to prevent capillary permeability. When you have think about what might happen in the bronchioles. Think about inflammation in the bronchioles. What would happen to the internal diameter of the bronchioles if they are inflamed? They're going to be swollen, so the internal diameter of bronchioles would be narrow, small. What would that do to breathing?
Slow it down.
Not slow it down by rate, but
Deeper.
will it be easy to get air in or hard? Hard. So if bronchioles are narrow, it makes it hard to get air into the alveoli. So why would we give that person a steroid? It ultimately blocks the swelling, thus it opens up the bronchi. So most of your patients, as you start going out into to nursing homes soon, you're going to see a lot of your patients on steroids, whether it be in an oral form, in a pill, or in an inhaler, to put the steroid directly into their lungs to block the inflammatory response. So steroids suppress the inflammatory response. They have multitudes of side effects that are not
I was about to ask that, because I've always heard, steroid treatment, that it's
so
bad for your immune system.
it suppresses the immune response. So what happens to your ability to fight infection? If you suppress the immune response, you suppress the ability to fight infection. That's a biggie. If you suppress the immune system, you suppress the ability to fight infection. So with our transplant patient, we suppress the immune response. What is another problem for them? Infection. If you suppress the immune system, no matter what way, they will also have risk for infection. High risk. Steroids increase or hold on to sodium. Thus, as a result of steroids, what else does it hold on to? If it holds on to, if the body holds on to sodium, it also holds on to water. Steroids increase the appetite, so they do eat more. Steroids destroy muscle. Persons on long-term steroids actually have muscle wasting. We're not talking anabolic steroids that some people take for muscle building. These are glucocorticoids. They actually destroy muscle. They cause an elevated blood sugar. Oh, I don't have diabetes, I just take steroids. What the patient will say, they have diabetes, but it was caused by steroids. It causes the blood sugar to go up. It prevents calcium from depositing in bones. What happens? If calcium can't deposit in bones, osteoporosis. So all persons on long-term steroids have osteoporosis. Persons on steroids get what's called a moon face. Big round face, and we call it a buffalo hump, a deposit of fat pad in between their shoulders. It's called a buffalo hump. So steroids are great to suppress the inflammatory response, but look at all the numbers of yeses here under adverse effects. Multitudes. See you next year.